The delay to WA's border reopening has caused confusion in many ways, including what it means for people who got their boosters early in the rollout. It's all a bit complicated, according to one of WA's leading COVID modelling experts, because of how the protection afforded by vaccines behaves over time.
We'll quite soon be in a state where the waning immunity will balance out the increases due to boosting.
Part of Professor Milne's work draws on data from the UK's vaccination rollout, which shows how the protection you get from boosters drops over time. According to data from last week, a booster increases protection against symptomatic disease to between 60 and 75% initially, before dropping to about 25 to 40% after 4 months. But protection against hospitalisation hangs around for longer, starting above 90% and dropping to about 75 to 85% after 3 months. The head of the Australian Medical Association in WA says those numbers should form part of the government's thinking about a new reopening date.
One of the factors that also has to be taken into account is the potential waning immunity of healthcare workers and vulnerable people who were amongst the first to get their boosters.
But waning immunity is not the only issue. Other experts say it's also important to consider the spread of Omicron through the community, with case numbers in WA steadily rising.
We're seeing an increase in community transmission, so people should be getting their boosters now and not later.
Particularly if they want the border reopened, something the Premier has said won't happen until WA reaches a higher booster dose rate.
Accordingly, the sooner more people get boosted, the sooner we're going to open up on that criteria if that's what they stick to.
The advice from health experts is clear. It's best to get your booster as soon as you can. They say it's far better to get the increased protection against Omicron now, even if it might dip over time. Kean Burke, ABC News.